Gabriel Myers, a 7-year-old boy who has been abandoned by his biological parents, always moving from one home to another, has recurring thoughts about committing suicide. He tries to ignore the thoughts as much as he can until one day he can't fight them anymore. He strolls around the house for a few hours looking for ways to activate his idea. Finally, he sees the object and walks in the bathroom, locking himself in. He sits on the toilet seat thinking, hoping no one comes in to use the restroom. Gabriel walks over to tie the knot, takes one last deep breath, and is successful. According to the St. Petersburg Times, last accessed August 14, 2009, 7-year-old Gabriel Myers, a Broward County, Florida foster child, hung himself with a shower cord in his foster home on April 16, 2009. Gabriel had been taking Vyvanse, a drug for ADHD, and Simbax, a combination of the antipsychotic drug Zyprexa and the antidepressant Prozac. The article further notes, Simbax carries a black box warning it might lead to suicidal behavior among children and adolescents, especially when first prescribed. However, Gabriel isn't the only foster child on medication. The Oregonian on June 17, 2009, published a report that 29.4% of foster children are prescribed at least one psychiatric drug. Some are as young as 4 years old. So because foster children are clearly a target for unregulated over-medication, today we will first take a look at the problems, second explain the causes, and finally discuss some solutions on how to stop at least one cog in the broken machine that is our foster care system. To begin, we can identify two main problems. First, prescribing medication is easy and time-efficient for psychiatrists. Psychiatrists don't have a law or requirement stating they must spend a certain amount of time with the client before prescribing medication, meaning a psychiatrist can easily walk in, ask what the symptoms are, and simply prescribe medication to that foster child at that same moment. This essentially allows for poor diagnosis due to many illnesses sharing the same symptoms. Psych Central reports on September 12, 2009, more than 75% of the psychotropic medication used for foster care children is off-label, the practice of prescribing drugs for a purpose other than the approved use on its label. 75%? Oklahoma's Channel 4 News reported on November 9, 2009, in 2007 alone, the state filled more than 15,000 prescriptions for antidepressants, more than 16,000 for antipsychotic medications, and more than 17,000 for ADHD. Now let's break this down. Hypothetically speaking, let's say all pharmacies are open 7 days a week. If we take the numbers for ADHD, which are 17,000, and divide that by 365 days, that means pharmacies fill about 46 bottles of medication every day, just for ADHD. Now, a regular-sized bottle of medication has an average of at least 20 pills. So this is what 46 bottles of medication looks like. This is what the state of Oklahoma is prescribing their foster children that are diagnosed with ADHD every day. Imagine if I showed you the numbers for all the medications that treat mental illnesses for all 500,000 kids in foster care in all 50 states. The second problem is social workers are overworked with the number of cases. After a child is taken away from their parents, the state assigns them to a social worker who essentially looks after the child and makes decisions that is in that child's best interest. Social workers play a direct and vital role in these children's lives. The Child Welfare League suggests that the maximum number of cases one social worker deals with should be no more than 12. In reality, that number is much higher. According to an article in the Social Workers magazine, last accessed September 30th, 2009, the daily caseloads for one social worker averaged being 31 families. So aside from making weekly visits, social workers spend countless hours writing reports, making phone calls, going to court hearings, and yet we're expecting them to complete all of this work efficiently in a 40-hour work week for each child? If we had more social workers, they would be able to focus on each child closely and make sure they are not being over-medicated. We have two causes leading us to these issues. First, psychiatrists are so economically pressured that they are seeing more patients for less time rather than having longer, deeper relationships with fewer patients. While psychiatrists are doing what they can to keep their jobs, these are children's lives that they are dealing with. Ones that have already been on a roller coaster and don't need another one. The Alliance for Human Research Protection Systems declared on July 15, 2009, drug companies are pushing psychiatrists to prescribe medications. Thus, they are misusing their authority. They are medicating children who are having normal reactions to normal childhood behavior. The second cause is social workers are not just overworked, but they are also unprepared. The Legal Government Association on June 17, 2009 stated, "Too many graduates complete their social work courses, but are unprepared for the reality their job intends them to do." Furthermore, the Miami Herald News on May 22, 2009 proclaims, "The work is also dangerous." 70% of social workers reported that they had either been threatened with violence or been a crime victim associated with foster care children. Providing training is essential to keep both our children and our social workers alive and well. Now, we may not have the resources to dismantle and rebuild the entire foster care system, but there are steps we can take on a federal, state, and personal level to end this medication crisis. First, on the federal level, we need to check to see if every child that is on medication truly needs it. The Oregonian on June 18, 2009 stated, "Oregon passed a bill which requires foster care children to have a mental health assessment done by a professional before being prescribed certain psychiatric medications. The bill also requires an annual review for those that are on 2 or more medications or under the age of 6. In essence, we need to do the same for each child, regardless where they reside. Second, on the state level, just like in any other career, there are certain specialties to serve a specific group of people. We need to do the same for foster care children. By providing training programs after or during the Master's Social Workers program, we can better ensure the lives of both our children and our social workers. Finally, on a personal level, there are many programs that we can volunteer for and be directly involved in the children's lives. For example, the Guardian ad litem. According to the St. Petersburg Times, last access August 14, 2009, guardians are the only persons legally appointed to represent and advocate in the best interest of a child. But most children do not have one. I started working with the Guardian ad litem in 2008 with Angie, who has been in the system since she was 3. She was prescribed Wellbutrin, an antidepressant, at the age of 7, just like Gabriel Myers. 6 months ago, Angie was taken off this medication due to her progress with these guardians and through this program. Now, becoming a guardian doesn't necessarily mean that you would be considered their legal guardian or that they would live with you in your home, but rather going to court hearings and making decisions that will impact their lives forever. Last but not least, our society does not encourage adoption. You may see signs that say, "Adopt a highway," "Adopt a beach." How about adopt a child? The Washington Post on September 10, 2009 declares that the federal government recently completed its state reviews for child protection systems, and every state failed. Today, we looked at the problems of over-medicating the foster children, examined the causes behind it, and finally explored solutions that may incite change within this broken system. Foster care system needing to change as a whole is one issue, but over-medicating the children is an issue we can and need to begin to tackle. These innocent children don't want anything fancy or materialistic. All they want is compassion, love, and to be free of mind-altering chemicals.